Good morning, everyone. My name is Simran Chaudhary, and I welcome you all to ThinkPink Advancing Breast Cancer Treatment Through Innovation, a virtual podcast series for Breast Cancer Awareness Month, October 2024. In this series, we will explore groundbreaking advancements in breast cancer care featuring insights from leading experts. And today, we are honored to host Dr. Niti Raizada, a distinguished Senior Director in Medical Oncology and Hemato-Oncology at Fortis Hospital, Banglore. She has over 21 years of expertise, a gold medalist, and the President of India awardee. Dr. Raizada is recognized globally for her contribution from leading as principal investigator in numerous multinational oncology trials to her extensive research and presentation at prestigious platforms like American Society of Clinical Oncology, UICC, and INCTR. Beyond her clinical and research contributions, Dr. Raizada actively participates in interdisciplinary programs and shares her insights widely, writing for esteemed journals and media. So, join us all as we explore her perspectives on advancing breast cancer treatment and how innovation continues to shape the future of care in this vital field. Welcome to our show, Dr. Raizada.
Thanks so much, Simran. Thanks for inviting me
Thank
today.
Thank you so much, ma'am. And your presence matters a lot. Your expertise matters a lot in this important health issue which we are going to discuss today. So, as we proceed, we know we observe Breast Cancer Awareness Month. So, what progress have you seen in awareness and early detection in recent years to the time where you have such a great and extensive experience in this? So the recent awareness and the changes you have experienced in your career.
I'm sure, Simran, not just me, but all of us have seen the widening intensity of campaign. We see so intense campaign in this October month across platforms, across newspaper, radios, across newspaper, magazines, and of course, YouTube promotions and television promotion. And it has actually impacted a lot in early diagnosis. So, if you look at a decade back or a couple of decades back, often we would discuss about in our country how often we see advanced stage breast cancer. We see stage 3 and stage 4 so common. People have large tumors which they don't bring to the hospital, and when they come, it's already spread to other places, or the patient's performance status has gone down so much that treatment delivery is difficult. But now, I mean, when I'm sitting in 2024, I can see that at least in a big city, we see a surprising trend in which early stages are diagnosed. We have screen detected cancer, which is known as opportunistic screening, which means I want to go to the hospital and screen myself. Second is that you feel an early, I mean, just a small self examined breast lump, you come to the hospital and we find early stage breast cancer. And all these early stage breast cancer or screen detected breast cancer are curable. Then second thing is that when you do a screening, not just cancer, but we diagnose precancerous state, precancerous state like ductal carcinoma and C2, which are just microcalcification, atypical microcalcification, which we see on a mammogram. And all these are definitely curable. So the spectrum has remarkably changed, especially in urban area, where we see a lot of early diagnosis and screen detected breast cancers. Most of them are curable.
I think, ma'am, you said it right because the change which I believe you would have seen throughout your career in the last couple of years or the decades, I should say, the awareness has risen a lot. People are now more aware of their health. It's just my thought. I don't know, would you agree on this or not? But the previous generation was more towards, okay, if something will happen, then we'll go to a doctor. Nowadays the generation is preventive generation. They take healthcare very seriously. They take regular checkups, whether it's blood test or any other test which is required, the annual health checkups. So they would visit doctors or the hospitals for their better condition and a healthy future. So I think that's how
Not
we
just
are.
that, availability of such programs also have increased. I mean, now you have so many packages. You would want to do at least check yourself once a few months, and then of course, if you are in a, let's say, in a software company or any multinational, they have mandated programs of an annual examination. If you're even buying an insurance policy, they mandate a baseline investigation. So all these, and everybody wants to take some kind of a health insurance for themselves. These all help in getting things closer, finding out your health issues faster.
So this is, I believe that's a collective issue. Like everyone is, putting their efforts for a healthy, happy life, for whether it's their employee or the person who has taken the insurance or the family members itself. So as we are focusing more on the treatment plans, innovations, and the advancements the medical industry or the medical sector has seen throughout the years, and that has made detection, treatment a bit, easier. So, can you tell us about the latest innovation in breast cancer treatment? How have these advanced options impacted patient outcomes?
I mean, again, innovation in oncology is not years, but it's days and months. Every few days, we have a newer technology which is more patient friendly and safer, and also the impact is better, and probably the results are better. So when we talk about breast cancer, it's all about personalized care. It's not like one disease you're treating, but a spectrum of disease. One breast cancer between two people could be very different, and we have to treat it uniquely. So we do tailor-made treatment or precision treatment for each individual. There are newer technologies which have made the delivery of treatment safer. When we talk about cancer care in breast, we do multimodality management. It could be chemotherapies, it could be surgical options, or it could be radiation option or hormonal therapy or newer therapies known as biologics or immunotherapy. Everything has become smarter. When you just talk about chemotherapy, the supportive care has become better. So you have safer chemotherapy which don't cause traditional side effects like too much of nausea, vomiting. It does not impact you on a long term, which cause long term problems are less. When you talk about surgery, we are talking about more breast conservation surgery, more uh, less of organ disfigurement, because you know that survivorship is very high and then psychological impact is huge. So we are making sure that the surgeries cause less psychological and social impact. Lymphedemas have come down. Breast conservation makes sure that appearance wise you're very good, and it doesn't leave a lot of then there these surgeries also have shorter stay in the hospital, so you get out of the hospital and back to your normal life faster. This radiation techniques have become more focused, so side effects like cardiac and pulmonary side effects are less. Then radiation related skin cutaneous toxicity are less. Newer drugs like targeted therapies deliver treatment right at where you want it. So if you have a HER2 expressing tumor or you have certain molecular markers expressed on the tumor, you give targeted therapy, which ensures that delivery happens only in the target organ, minimizing the side effect and also improving the effect of treatment. In certain areas, we use immunotherapy drugs, which are immunity modifying drugs. So your own immunity is modified so that you respond better to treatment. Now, not just that, the diagnostic front has improved a lot. So we have faster diagnosis, sharper diagnosis, better molecular characterization, and including the screening methods, which because of AI integration have become better.
Thanks a lot, ma'am, for explaining that to us and to all our audience in a very simple layman language, so that everyone around who are aware of what exactly is breast cancer, because of the people nowadays has become very vocal, including celebrities or the normal public, people like us. But just to have more trust, more faith around what exactly is coming, the treatment options, they need to know better of what exactly is there. So I think that builds a little bit more faith around the treatment. So as we're discussing about the innovations and advancements, what role do you see of immunotherapy and personalized medicine playing in breast cancer care today?
Actually, immunotherapy started as therapies which modify your own immunity in later lines of breast cancer and other cancers. But now that is moving up in the ladder. And in certain breast cancer subtypes, like triple negative breast cancer, initially we normally start with chemotherapy along with immunotherapy and then do surgery so that the results are better in the long run. It's also predictive therapy, how the patient is going to do later, and can we modify treatment and make sure that we give adequate treatment for each patient. So if they need more treatment, you can intensify treatment. If they need less treatment, we can cut down on treatment. Also, we have to remember that immunotherapies are very simple therapies, generally given as infusions, and also have very less side effects. Then when we talk about other new generation therapies, as I said, they are targeted therapies. So we have drugs which target the problem which is expressed on the cancer cells. So if you have HER2 as a target, you would get an anti-HER2 therapy. Now, anti-HER2 therapies are also becoming better and better. They are dual anti-HER2 therapies which we give. Instead of giving IV, give subcutaneous, so that the duration of stay in the hospital is less. The side effect of infusional treatment is less. Then we tag chemotherapy to that biologic therapy. So we have a target, and you deliver that target on the tumor tissue, but tag on with a chemotherapy agent. They are known as antibody drug conjugate. So you deliver
Hmm.
chemotherapy at exactly the place where you want to target. Instead of targeting, chemotherapy is generally known to be a very non-specific therapy which works on all fast multiplying cells. But now we have a target, and we tag chemotherapy to that target. So it delivers right at where it has to be delivered. Also, the next thing is that when you talk about advanced breast cancers, we try to give standard therapies based on what expression they have. But at some point in time, you need more molecular information. So we can send blood samples known as liquid biopsies, or we can send tumor samples known as biopsies for next generation sequencing, or sometimes Sanger sequencing. And we find out whether they have any specific expression. And so newer therapies known as, again, biologic therapies can be delivered or not. Some could have heritable cancers which are hereditary in the family. So they are also treated uniquely and differently.
Thank you, ma'am, for putting light on all this important aspect, because in this month, or let's say this year, we are focusing more on the advancements of front. So since we're talking about this, so AI is a new buzzword in medical industry as well. So how are technologies like AI and machine learning transforming the breast cancer detection and diagnosis?
It's also a very useful question for all of us. And then the next question is, are the doctors going to be replaced? So let's leave that behind. But yes, integrating AI is useful. See, most important thing is data analytics. We have so many studies, we have so many things, so much research happening. How do you integrate the data? And the best way is obviously machine learning and artificial intelligence, which can usefully integrate the data so that we can apply it in practical medicine. So, starting from screening, I mean, with the use of AI, we have smarter predictive. So, if we actually, let's say, we are doing a radiological imaging, the results or interpretations have become easier when you have a radiologist and an AI tool. So AI can at least screen those, and then a radiologist can come together, decide whether these are useful and should be reported as positive, negative, or how suspicious. So basically, AI tools in radiological reporting, AI tool in pathological reporting, digital path in which you can transfer the image to a higher center where the pathologist can report, and also preliminary screening by an AI tool. Then they are again AI predictive breast cancer risk models, which have become very useful. You, at a certain age, at a certain family history, your personal data points, whether you have a lifestyle which actually puts you at more risk, and then you have a genetic mutation, integrating all this data. This is known as predictive tools. These have become better. When you talk about therapy, well, again, integrating the usefulness of data for a rare case. Bioinformatics is very important. So I have a report which gives me a spectrum of molecular mutations. How can I usefully integrate it in patient care so that I can get good outputs? So these all are the current areas in which we have been doing practically using AI a lot.
And ma'am, like you said, whether AI is going to replace doctors or not, I believe that won't happen, because that effort, that manual direction, and that thing to analyze what will suit, and that human touch can never be missed out, or should never be missed, which AI can never contribute to the treatment process. So, in terms of precision medicine, how are genomic profiling and other advanced diagnostic helping to create more personal treatment plans for patient, or I should ask, for the advanced stage cancer patients?
Yeah, as you said, genomic profiling is absolutely, I mean, changed the way we look at advanced breast cancer treatment. Actually, genomic profiling is very useful in certain early stages, other cancers like lung, etc. But in breast, at this juncture, we still use the protein expression known as immunohistochemistry as the basic tool. So once you have a immunohistochemistry, we club breast cancer into hormone positive, HER2 positive or triple negative subset, and normally treat them according to this in the first line setting. However, we use certain other mutation markers like a BRCA, sometimes a PDL1, to decide how you will treat an advanced cancer. So, if first line therapy has failed, we need a plan which is customized, which works basically based on the expression of genomic profiling. So, we use larger platforms in which we get a spectrum of genomic mutation profiling, and based on the combination of those we decide whether we need to change a drug. So an ESR expression will be treated differently, a PAL-B2 expression will be treated differently, or sometimes a combination of various things. If a PDL1 is expressed and a BRCA1 is expressed, how will you treat? So this is normally what we do, and this is in regular medicine. It's not in high-end medicine. It is what we do on a day-to-day basis.
Thank you so much, ma'am, for putting light on that and explaining to us. As we move forward with the session, the next topic we'll be discussing about the patient-centered care and how important is that with the combination of the treatment, because after, not only treatment but other things, which other factor which help a patient to get that hope that we are going forward, we'll be cured out of this, all matters a lot. So, with patient comfort and quality of life as top priorities, what new approaches are being implemented to minimize the side effects during the treatment?
Simran, your question can be taken up in few things. See, one is the medical care during treatment. So, as I said, supportive care has improved a lot. There are drugs which reduce vomiting, which actually generally supportive care drugs which improve your nutrition. So, onco nutrition is a part of treatment. Physical therapies like respiratory exercises, physical measures which keep you active during treatment. And third thing is supportive care drugs which reduce problems during treatment. That is one. But then the second important thing is psychological support. Whether during that time you have enough support within your family is one, but within in the hospital settings, do you find a person whom you can communicate with, and do you have a person, if you have questions to ask, who can share whether the initial phase of denial, anger, is there somebody who's coping up, helping you cope up during that time? So, psychological support by a psychologist from time to time, a support group which actually helps you deal with it by having discussion and people who have gone through the same journey and who have done well. So, interacting with the current patients who are taking treatment and interacting with the survivors, not just taking care of the patient but taking care of their families as well, because caregivers are the people who get more drained out during treatment. So psychological support by a psychologist from time to time, a support group which gives everybody has a one-side psychologist and which takes care how the patient is doing during the treatment. There's a lot which supportive care provides, as you said, psychological support during time to time. On the regular basis, the patient having multiple interactions with caregivers, this can increase the benefit or the outcomes Am I audible, Simran?
Yes, ma'am, you're audible. You're audible and you're visible.
Yeah. So, psychological support, social support, having good support to the caregiver. And so, what we have is in our hospital, we'll always have supportive care teams who's dealing with all this. We'll have an onco nutritionist, we'll have a psycho oncologist who will also be running a support program, who'll be talking to them regularly. There'll also be physiotherapists who'll be talking about physical measures you can take during the treatment. And then, of course, they'll also be sometimes needing social help. They may not be able to come to the hospital regularly. So some teams, they are integrated to help them to the bring to the hospital whenever required, or at least having a telephonic contact. They can just call up and find out what can be done. These always run around the patient care. So we have to focus on the entire thing, not just the delivery of treatment, but entire patient focused care.
That's great, man. That shows how holistically a patient is taken care from all the aspects with the help of doctors, by the doctors, and now because of much more understanding how it not cancer does not only affect a body part or the body, it affects overall. So all kind of help is required, and I believe the medical team is doing their best, on their toes to provide all the services and benefits they can. So, moving forward, focusing on the challenges in the future direction, what do you think are the main challenges still faced in breast cancer treatment, and how are researchers and clinicians working to address them?
As I said, Simran, this is the commonest cancer. Not, I mean, in India, of course. And if you look at global data, also it's the most common cancer amongst women, and also one of the commonest cause of cancer-related death in continents like Africa and even in Asia. So what first important thing is, since by the time they come, sometimes they have wasted a lot of time, and that's the crucial time which we could have salvaged the patient. So most important is that the time in which they come. So penetration of your regular screening program is extremely important. Second thing is that in spite of sometimes the best possible treatment, there's an aspect which we cannot forget, known as resistance, drug resistance. They may not really respond to standard treatment because, as we all discussed, that it is not one disease. There might be a certain unique variant which does not respond to the best measures. Social disparities, we really can never forget that there are rural areas in which patients are not even, I mean, they think cancer is the death sentence. Why should we even do it? Their understanding is not adequate. Patients probably, the families don't want to treat a person of cancer. They don't want to bring out that the patient has cancer. So they are not informed adequately. All these are challenges, I think, which will take a while for us to overcome. But again, we all know that these are improving. But even in certain families, even now, it would be a hush hush thing. It would be something which would be a stigma, and you would not want to speak about cancer.
It is, ma'am, and that's why we are focusing more on the awareness and the treatment plan so that people should be aware of, okay, if they have got cancer, there are many other ways that can be treated because of the medical advancements and the innovations. And India is capable of treating everything if we get diagnosed on time, screened on time. Then we can do it definitely. And then cancer is definitely not a death sentence for anyone. So it's just you have to be very careful about your health and take preventive measures accordingly. So for those, ma'am, tuning today, what some crucial steps they can take to support breast cancer awareness prevention in their communities? How can they spread awareness? And just one, this practical tip for women out there: how can they do self exam breast examination for this? Ma'am, you're on mute, ma'am.
Hear me?
I can, I can hear you, ma'am. You are still on mute now. Yes,
So, can
yes,
you hear me now?
I can hear you now.
So, Simran, first important thing is that, as you mentioned, we have celebrities who talk about breast cancer. So, first important, if you have had cancer, please talk about your journey. It may be difficult initially, but then the entire life is ahead of you, and this may just be a small aberration in your entire course of life, but it can be a life-changing event as well. So, talk about it, and your journey may help so many people. If you have had an experience, please talk about the experience. Who have education can at least make sure that in their communities, in their areas, they can probably run camps or they can run awareness programs, bring people to talk about it. Third thing is, even a nurse, even a healthcare worker should be educated to do a breast examination. That breast examination could be, there could be a gathering of 100 women and a nurse could be examining them and bring it up. Then fourth thing, as you said, is just talk about breast self examination, which is done once a month, and any short useful video can tell you how to do. So just use three fingers flat on your breast in a clockwise or an anti-clockwise direction, by keeping your hand under the shoulder and examining not just your breast but your underarms as well. So opposite hand for the right hand for the left breast and left hand for the right breast and the underarm. Also examine your neck at the same time. Examine your breast, your underarm, and your neck. If these basic things can be done, it can actually change the way things have been.
Thank you so much, Dr. Niti, for explaining us that to us and to all our audience and creating this awareness. So, one last closing message to our audience today.
The most important thing I want to say is trust the science. I mean, you may talk about alternative medicine and so many things, but please have some trust in science. Have trust in your doctor. Each doctor wants to treat you the best. Everybody wants good results for their own peace. Not for, sometimes not just for, it's for your own peace. You want your patient should do well, because that gives us the satisfaction nobody can imagine. That's what we have been kind of brought up with. And then, of course, the most important thing is your resilience and your inner strength. Be calm during the process. What we cannot change, we probably have to make sure that our attitude is most conducive to the right treatment. Thanks so much for calling me
Thank you.
today, Simran.
Thank you so much, ma'am, for being part of our initiative and creating this awareness with us and being one of the strong voices to create awareness about breast cancer. As you said, and we all aim for this. That let's not focus. Let's be more vigilant and be more focused around the screening, diagnostics on time, and so that we can prevent breast cancers in future and we and contribute our more energy in screening, not in treating. So thank you so much, ma'am, for being part of this session and sharing your insights and expertise with us, because this matters a lot. Thanks a lot for giving your time.
Thanks so much.